Welcome to today's episode of Oncology Data Advisor. Today we have another interview from the ASH annual meeting, and I have the pleasure of being joined by Dr. Richard Godby, who's here to tell us more about the abstract he presented titled Defining and Developing a Curriculum for Systems-Based Hematology. So, Dr. Godby, thank you so much for coming on the show today.
Yeah, thank you so much for having me. I appreciate it.
Of course, looking forward to talking with you. To start off, would you like to tell us a little bit about yourself and what you do?
Yeah, so I am a classical hematologist, and I have a background in transfusion medicine as well. And my interests are in medical education and systems-based hematology.
Awesome. Looking forward to hearing more about this research you presented. So, for background, would you like to tell us what exactly is systems-based hematology?
So that is a great question, and a lot of people find that kind of difficult to put a very fine definition on. What I would say is I like to think about systems in general, which are composed of multiple interacting pieces or components. And to me, systems-based hematology is working with each of those components to optimize healthcare and its delivery to the right patient at the right time in the right place. And that involves pretty much always multidisciplinary collaboration in different initiatives varied in both the scope and the scale of intervention.
Awesome. Thanks for explaining. So what are some of the gaps in standardizing the field of systems-based hematology?
So right now, a lot of systems-based hematologists do different work that's important to them locally, but without clear definitions and without standard training, that varies by institution to institution and even by individual to individual. And so, trying to standardize a vocabulary, and a good way to do that is with a standard curriculum, could really help probably tackle some larger problems facing society.
Great to know. So what were you and your team investigating in this study?
Yeah, so we basically wanted to meet with experts in systems-based hematology to figure out how they defined it and some of the different projects that they've been involved with, and use that as well as get their input on what a national curriculum might look like, and get their thoughts on it before we started designing the curriculum.
Great. So how'd you go about designing and conducting the study?
Yeah, so this was a qualitative research study. And so we were hoping to do five, but we were actually able to do eight semi-structured interviews with systems-based hematology experts. And we took those interviews and their answers and performed a thematic analysis to try to extract kind of the high-level themes and sub-themes from our various conversations around systems-based hematology and around designing a curriculum for everyone essentially to be able to learn these basic skills.
Awesome. So what were some of the themes that the interviews revealed?
Yeah, so the big one that we focused on was basically training and education. This was actually a project that emanated from my participation in the ASH Medical Educators Institute. So very thankful for them for all their help and resources. But the consensus was that there was essentially no curriculum for systems-based hematology, and everyone had a very different background in terms of how they became interested in the field and how they gained their expertise. And so everyone was very interested in moving forward with the curriculum to hopefully not only increase interest in the field, but again, to standardize a vocabulary and make sure that we're all starting from the same um, point when we're approaching a different problem. There are other fields that are more general. So a different field is called healthcare system science, and it's looking at the various components of healthcare systems and just how they're structured, how you deliver care. There's components of quality improvement, value, safety, even some healthcare economics and implementation science. And so these were all very attractive to the different interviewers in terms of how they relate to systems-based hematology. So those were areas that we would probably focus on, but incorporate hematology-specific examples to help someone helping in the care of patients with blood disorders. But the other things that we found, as you had already brought up, was the definition of systems-based hematology can be a little bit nebulous. And so trying to come up with more concrete examples and again, the curriculum would help with that in terms of what exactly a systems-based hematology or hematologist entails. And but they often compared its role and scope to a common understanding of what many people term as antimicrobial stewardship. So if you work in a hospital, folks are familiar with antimicrobial stewardship because you kind of think about it with ID, but it applies to all different systems within the hospital. And so it's kind of an analogy that a lot of them drew. We also talked about some of the challenges, and so it's kind of under-recognized as a field. Not a lot of people understand how great it can be and everything that it can be involved in. But some of the value in it, it might be a little bit difficult to capture and quantify, and therefore it makes it hard for people to do the work on a sustainable long-term basis. And so trying to help people um, uh, actually quantify what they're adding to the system through this work is really important and should be part of the curriculum. And then lastly, a lot of people talked about the bright future of systems-based hematology. And right now it's mainly driven by classical hematologists, but more involvement from the pediatric specialists as well as the community hematologists and even the malignant hematologists they all have something to add. And so including them will be really important in developing the curriculum and moving the field forward. And so they were all great conversations.
Absolutely. That's really great to hear about those results. So how can some of these changes that the experts suggested and the results and themes you found in the analysis be used to help inform the development of educational resources and training programs?
Yeah, so a lot of it was trying to understand the different aspects of what a systems-based hematologist does. That way we could create the content. And so while quality improvement is part of systems-based hematology, there are multiple other aspects. And you can have specialists in data information and working with your IT department. It can be patient safety. It can be leadership and how you bring different teams together. It can be influencing policy, both not even, on the floor that you're working on, but across the whole hospital or even nationally. As a lot of folks have experienced drug shortages and changes in the supply chain, working as a community and a group to bring all of that together it showcases the wide range of skills and talents encompassed within systems-based hematology.
Absolutely. So do you have any next steps for the research?
Yeah, so we would love to publish our results, but ultimately, I think it would be great to work with ASH and other national organizations to actually pursue designing this curriculum and have experts from the various aspects of systems-based hematology provide some lectures and to again give everyone who's interested access to that education, but also help everyone start using the same vocabulary and thinking about problems in a similar way. And so I would say that is the next step, and I'm very excited for it.
Very exciting. So to wrap up, anything else you'd like to mention about the research or any key takeaways for our audience?
I think I think there are lots of resources out there, and if you notice something that can be better for your patients, or for the system, or for yourself, that it's probably real, and to figure out the best tools to quantify that, and to work with your local teams to make your system better.
Sounds great. So my last question for you to wrap up, this is a question we're asking at the end of every interview we're doing for ASH, is if a patient asks how this research might affect their care, what would you tell them?
So I would tell them that they might not notice a direct person or a direct paper, but everything from the time that they make an appointment to the time that they get treated and are following up, whether that be inpatient or outpatient, can be influenced by a systems-based hematologist or just the field of systems-based hematology. So having, again, not over testing and not under testing and making sure it's occurring in the right place in the right time and that the right doses of the right medications are delivered and that the policies and reimbursement surrounding all of that doesn't negatively impact them, basically making their healthcare as smooth as possible and getting them the best results that they want. So it's kind of all working together in the background to make it as smooth as possible for every patient, regardless of the situation they're in.
Definitely. It's great to know and a great message to share. So thank you so much, Dr. Godby, for coming on today to tell us about this research. It was wonderful to hear about and appreciate your time.
Thank you so much for having me. I appreciate you.